What's the best mouthwash and how do you know which one to choose?
Hello, I'm Dr. Rachel from Evolve Dental. I'm a holistic dentist. What is the best mouthwash to use? Have you ever wondered which is the best mouthwash? What's the best one you should get when you go to the supermarket or store? I mean, you go in there and there's the aisle with all the dental products and there's just these shelves stacked full of all these different mouthwashes, different sizes and different colors. How do you know which one you're supposed to get? How do you understand? I know it's so confusing, and that's why I've made this video for you. What's the best mouthwash to get? Now, that's a question I can't answer in general or broad terms, there's no one size fits all. And as a dentist, we base our advice on your individual needs and what's going on dentally for you. So what may work best for me might not be best for you. What's best for your partner or your kids might also not be the one that works right for you either. Every mouth is different. And so before you determine which mouth rinse is the best for you, I'm going to give you a few indications of what the mouthwashes are for and what they help. But before we do, mouthwash is not a replacement for brushing and flossing. It's not something you do instead. It's something you do as well as. I know that ads try and make it look like you just swoosh this around your mouth and boom, you're never going to have decay or problems with your gums or bad breath ever again. That's not true. You still need to brush and floss, guys. Sorry to break that one to you. This is an addition to your oral hygiene routine. So which mouthwash? A supermarket bought one, over the counter at the pharmacy, or one that your dentist prescribes. Now, if you've got severe problems with your gum health or with dental disease or cavities, then there's some specific mouthwashes that are recommended by your dentist that might work better than one just off the shelf at the supermarket or over the counter. To decide exactly what's best for you, you should talk to your dental profession. The person who sees you and your mouth regularly, so your dentist or your hygienist. They're going to know what your health needs are and they're going to be able to point you in the right direction. But there are four. There are three types of mouthwashes that you can use. Now, number one is an antibacterial or antiseptic, and that reduces the amount of harmful bacteria. There are those that are anti-inflammatory and they help boost your immune health and they actually help heal your gums. These are probably going to be a bit antibacterial as well. And then there's the third type, which is the anti-cavity one, which is either going to have xylitol or fluoride as the main ingredient. And that third one's probably going to have some antibacterial component also to reduce the amount of plaque that you build. Now, importantly, if you want a natural mouth rinse, then you've got to look for one that's alcohol-free as well as fluoride-free. You want to have one that contains essential oils, and those oils alter the bacterial cell wall, so the bacteria die and they can't breed. These are really good mouthwashes for your gums, really good at helping to treat gum disease and to prevent mouth infections. Now, I don't know about you, but I sometimes find that a problem with a lot of mouth rinses is that they burn your mouth and you can't hold them in for long enough. So I find that if you dilute them with some water or you wait a while after you've brushed your teeth so the toothpaste is kind of gone from your mouth, that helps to reduce that burning sensation. So there's a nice little tip for you. Other mouthwashes you can use are ones that reduce bacteria and they contain hydrogen peroxide, such as this one from Colgate called Peroxyl. This is good for your gum health and surprisingly no fluoride or no nasties in this. You can use ones that reduce cavities, so try one with xylitol. That stops bacteria sticking to your teeth and forming plaque buildup so readily. Avoid mouthwashes with alcohol in. They've been linked to an increased risk in mouth and throat cancers. They also dehydrate your mouth, and that actually encourages more bacteria to breed and to breed more quickly, and it's kind of doing the opposite to what you want a mouth rinse to do. If you have issues with your gums and cavities, use an antiseptic and an anti-cavity mouthwash. Use the antibacterial morning and night and the anti-cavity one prior to bed. So here at Evolve Dental in Brisbane, there are 3 mouthwashes that we recommend. 4, actually. I can't count today. Sorry, guys. So we've got Gem, and we've got EcoDent, and we've got Peroxyl. It is 3. It's just I've got 4 on my desk. Anyway, the EcoDent. This is a lovely product. It contains lots of essential oils. It's anti-inflammatory, antibacterial. It's got bicarb to neutralize acid, raises the pH in your mouth. Bacteria don't like an alkaline environment. Great for gum disease, helps reduce plaque buildup as well. Then the Gem, this has got a load of good ingredients in, and I'll do another video on this separately for you. This is great to help reduce cavity risk because it's got a lot of xylitol in, and it's also got an antibacterial action. And then you've got the Peroxyl, that's hydrogen peroxide base, really good for people with gum disease. We use that as a pre-rinse before we do dental treatment, helps reduce bacterial and viral load. I hope you found this useful. I hope now it's less confusing for you when you go and choose your mouth rinse. Please do like and subscribe and leave your comments and questions in the area below. Thank you so much. I'm Dr. Rachel from Evolve Dental.